Low back pain is a major problem for up to 85% of adults. There are many different causes of low back pain, but the good news is we found one simple stretch that can help most people who are suffering from it. In this video, I'm going to explain why this stretch helps, how to do it, and how often you should do it. It's my go-to stretch and it has helped hundreds of our patients. The crazy thing is, most of these patients have had low back pain for years, but have never tried it. One of the reasons I love this stretch is because it has helped me many times with my own pain. It's a stretch that can seem a little counterintuitive to most people. This is because the stretch is for your legs on the opposite side of where your pain is. Before we get into the stretch, I want you to know why it helps to do this stretch and why the muscles in your legs can cause your back to hurt. The reason why your hip flexors or your quads can affect your back is because these muscles that go from your thigh up to your pelvis, if they're tight, they're gonna pull down. They pull down, it's gonna tip my pelvis forward. When the front of my pelvis tips forward, the back of my pelvis tips upwards. And what that does is it puts your spine in a little bit of an extension moment. Here's the pelvis. As it tips forward, it's going to arch the back. And what happens there is a lot of these structures where your nerves come out on each side at every level in your spine, when your back arches, the space where those nerves have to live or exit gets compressed. As you age, that space becomes naturally smaller. A lot of times they will call that spinal stenosis. So even if you have spinal stenosis or spondylosis or one of those other osis scary words that neurosurgeons like to throw out there, the position of your pelvis can definitely affect your back. So by stretching out the muscles on the front of your pelvis, it's going to allow the glutes, which are the opposite of your hip flexors, to pull yourself back into better alignment. Sometimes that can help people have less pain. Now, if you haven't already, please take a second to subscribe to our channel. We love putting out free content for you, but we need your support to keep it going. Okay, so now you know why you need to stretch your hip flexors. Next, let's talk about the best and worst ways to stretch them. There are many different ways a physical therapist may have you stretch your quads or your hip flexors. A common way is laying down on your back with your legs hanging off the bed. But honestly, I hate this one. I've seen way too many of my patients flare their back pain up doing it this way. Plus, the amount of stretch we get usually isn't enough to make a real change. Of course, this is just my opinion based on my experience. Another common way would be to lay on your stomach and pull your heel towards your butt with a strap. I personally do the stretch this way from time to time, but it does require a little bit more core coordination to keep your back from arching. Also, a large percentage of our patients really don't love being in the prone position or lying on your stomach. On a side note, I'd love to get most of those patients to become more comfortable with lying on their stomachs or prone, but that's a video for another time. This brings me to my favorite position for stretching your hip flexors, specifically your quadricep muscles. All you're gonna need is a stable chair, something to hold on to, and another chair turned 90 degrees that has an arm on it. If your hip flexors or quads are super tight, I'm going to show you a couple variations to mitigate that. So hold on to the chair, and the key to avoid getting a cramp in the back of the hamstring, which is really common and something that happens to a lot of our patients, is lean forward onto the chair or a countertop if you have it. Lean forward and swing the leg around and up to the arm of the chair. Don't try and stand up tall and pick your foot over the chair because that's a recipe for a cramp. Lean forward, swing the leg around, put it up on the chair. And now what you're going to do is tighten your stomach and squeeze your glute as you stand up nice and tall. By keeping your stomach tight and your glute squeezed, you're going to prevent your back from arching forward, which could reproduce your back pain. If you do get a little twinge of back pain when you do this stretch, again, focus on the core, squeezing the glute down, which is going to flatten that back. And by doing this, it should also increase the stretch in your quad. Remember, this is called the quad stretch. It seems like common sense, but what you should feel is a stretch in your quad. If the stretch is too strong, if you're trying to stand up and you're coming up and you really feel it pulling and you can't get up and you're feeling like it's pulling you back into a flex position, then it probably means that you're so tight that you need to turn the chair towards you and start off same way, lean forward on the seat of the chair. If you're somewhere in between, then take a pillow and put it on top and start to work your way up to the arm of the chair. I want you to do this every day, maybe even twice a day for the first few weeks. Think of it as maintenance on your car. If you put your leg up on the chair and you feel a good stretch, then you need to do the stretch daily. After a few weeks doing it daily or even twice a day, and you get your foot up on the arm of the chair, if you stand up tall, keeping your stomach tight and your glutes tight, and you don't feel much of a stretch, at that point, you can put this stretch into maintenance mode where you want to check it every other day or 2 to 3 times per week. After playing golf or working in your yard, doing other things that involve a lot of bending over or hip flexion, doing that kind of thing for long periods of time will tighten up your hip flexors. And what we found is that most people tweak or injure their backs after their hip flexors have become tight from doing things like that. So this is a great stretch to do, anticipating that you just got done doing something that could leave you with tight quads. If you have any questions, please leave them in the comments below. As always, I will do my best to answer every one of them. Also, make sure to check out some of our other videos like this one. Until next time.